In this video, we're going to discuss ankle sprains. Ankle sprains account for an estimated 2 million emergency room visits in the United States each year. It's more common in females. It's about 50 and 50 as far as occurring in sports and while performing other activities. It's also more common on the outside of the ankle, known as a lateral ankle sprain. Those sprains are graded in 3 grades. Grade 1 typically is somewhere between 1 to 3 weeks for recovery. Grade 2 is going to be between 3 to 6 weeks. With grade 2, you're going to have instability. Both grade 1 and grade 2, you're going to have loss of range of motion, as well as some pain and swelling. Grade 2, you're going to have that instability. Then going into a grade 3, typically that's a complete tear of the ligament. You're going to have that from 6 weeks on to several months later. And with that, there's going to be severe instability, and in some cases, that is going to require surgical intervention. However, people that have an ankle sprain, the greatest predictor for a second ankle sprain or more subsequent ankle sprains is the fact that they had that first ankle sprain. It's estimated that around 70% of people that have underwent an ankle sprain are going to have some sort of physical deficit or physical impairment related to their foot ankle from here on out. So you want to make sure and have that addressed with proper strengthening, motor control exercises, and then proper grading back into functional performance of mobility and daily tasks. After suffering an acute ankle sprain, the first thing we're going to do is we're going to work on range of motion. So I have a bolster here. You can roll up a towel, put it behind the lower leg here so that the back of your heel is just kind of floating here. I'm going to go down into flexion, so I'm pointing my foot forwards. I'm going into extension, so we're going to go flexion and extension. Then we're going to work on side bending kind of in and then out. That's that inversion and eversion. You're going to work on that coming in with the foot and then back out. And then we're going to work on just making circles, both clockwise and counterclockwise. We're going to work on that several times a day. I don't really count repetitions with that. I just tell patients, sit down, or while you're sitting, go through maybe 5 or 10 minutes of that range of motion exercise, going through several of those movements. Next, you're going to want to work on strengthening and loading these ligaments, tendons, muscles, all in this area. A lot of times, yes, while it is an ankle sprain where you have sprained the ligaments, you're going to also have very commonly some irritation of the tendons and the muscles in that area. You can strain those muscles. And so we want to start loading that tissue. And we're going to take this exercise band, put it around the ball of my foot here, and I'm going to push down. I call these gas pedals. I'm just pushing down just like you're pushing a gas pedal on a vehicle. That's also known as plantar flexion. So we're going into plantar flexion. I'm going to complete somewhere between 2 to 3 sets of 10 to 15 repetitions of that movement. And then what you're going to do is you're going to cross your leg over. I'm going to put this band across the top of my foot. I'm pulling down, and I'm going to pull my foot back. And you're going to work on pulling your foot back, and that's known as dorsiflexion. So we're just going to pull that back, 2 to 3 sets, 10 to 15 repetitions of that movement. You want to make sure that initially you start with a band that's such that you can go through the movement with predominantly most of the range of motion. You wouldn't want to just go statically, although in some cases where this is really flared up, very sensitive, you're not able to even go through the range of motion. You can do this in an isometric fashion, so I'll just show that. An isometric is where there's going to be a muscle contraction, but there's not going to be any movement. So I'm pushing down, kind of like in that gas pedal movement, and I'm pulling back with a band, applying a lot of force here, and I'm just barely pushing in. And as I'm pushing in, I can feel my calf muscle back here, contract, but there's no movement of my ankle. You may see a little bit of just some of the muscles kind of firing there, but we're just going to push in. And then I'll have my patient hold that maybe for 10 to 15 seconds and do that for a couple of sets. And you would do the dorsiflexion where you're going to pull your foot back the same way. Just pull on that band so that there's just barely any movement as far as the joint. Try to eliminate movement completely and just contract those muscles and hold that. So that's starting with the strengthening, and I typically have my patients start that somewhere between 3 to 7 days after the initial ankle sprain. Now we're going to work on just statically standing on these foam balance cushions. So what you want to do is you're going to stand on this with both feet, preferably barefoot. I just have my socks on. If you don't have a balance cushion, you can just take a towel, a bath towel, fold that up so that it's kind of thick, and just stand on it. Just working on standing here statically. I'm not doing anything. And then I would do this, and maybe say I'm going to stand here for 1 to 3 minutes, and then get off, go back on, another 1 to 3 minutes. And then you can also eventually, over the first few days with that, work on standing, closing your eyes. You just stand there and close your eyes. You can close your eyes and then go into head movement. So close your eyes, turn your head left to right. If you make sure you have something to hold on to and catch yourself, you don't want to fall. Just work on that to start some of that proprioceptive response, that kinesthetic awareness of the joint, and back to the brain. So we do that typically 3-5 times a day maybe. I've had patients even do that every hour, get on their balance cushion or get on the towel that they're using. Maybe do that 1 or 2 times each time they do that. So you just want to do that throughout the day. Now, taking this same balance cushion, what you're going to do is you're going to go into just a partial squats. I'm not going to squat down deep. My feet are a little close together on this one. This is not a big cushion. You can use 2 cushions or buy a larger one, or again, take a couple of bath towels and fold those over. So I'm just going to go into just a mini squat. I'm just kind of coming down and then back up. Definitely not going deep. Just going nice and easy. Really focus on controlling my knees, controlling my ankles. I'd complete that for 2 to 3 sets of 10 to 12 repetitions. And I would start that. It depends if this is a grade 3. If this is a grade 3, that's going to be a little later on before I can start that. But typically with a grade 1, I'm going to be starting that within the first 7 days if possible. That would be my goal, to continue with the range of motion exercises we did here, as well as using that band going in through those movements. Then we're going to progress to statically just standing still on top of the balance cushion, and then work on eyes closed and open, going into that partial mini squat there, standing on a balance cushion. And then we're going to go into this last one where you're going to stand on one leg. So we're going to say it's my right ankle that's been sprained, and I'm just going to work on standing there and try to statically hold that. You're going to see my foot just really working all around me. So we'll do that. And then we're going to work on other things such as, restoring our gait pattern, making sure we're walking appropriately. And when you walk, your heel hits first and you roll through your foot and you push off your toes. All those types of things need to be normalized as fast as possible. So typically within the first 7 days after an ankle sprain, I know you were not putting weight on that maybe for the first day or two. Maybe you're on crutches, you have it wrapped up with an A-strap or a brace. Maybe you're applying ice. But typically within those first 7 days, I'm going to start all of these movements, and I'm going to start trying to restore and normalize my gait or walking pattern as fast as possible. Things like return to sport, more aggressive exercises, cutting exercises, more advanced balance exercises. Those things come, and with a grade 1, I'm typically doing that at about the end of week 3. And at the end of week 3, we're starting those things. So for a lot of competitive athletes, or if you are an industrial athlete, you work in maybe steel factories or oil field or construction, those types of things, we're going to work on having you back at full functional capacity at about the 6-week mark. Thanks so much for watching. I hope this video helps with your pain, range of motion, and strength to allow for restoration of functional use of your lower extremity after an acute ankle sprain. Thanks so much.